Okay, we have an extra special Let's Talk Jonesboro coronavirus edition with Dr. Shane Speights of NYIT at Arkansas State University. Thank you for joining us, Doc. We have seen numbers spike in Jonesboro, and this is an event that you told us what happened by late September. Well, voila, here we are. Tell us, we've been dealing with this for 8 months. People have their various ways of going about life. Tell us what we should be doing, what we know now, and what we should be doing about it.
Thanks, Bill. I appreciate you having me today. Yeah, you're exactly right. Unfortunately, what we were hoping would not happen is what we're seeing now, which is an uptick in cases, not only across the country, but certainly here in Arkansas. We're seeing a significant increase in Northeast Arkansas. In terms of the state of Arkansas, Northeast Arkansas, Northwest Arkansas, and Central Arkansas are getting hit pretty hard right now. A lot of that boils down to, interactions, personal interactions. It also boils down to mask compliance here in the state of Arkansas. Unfortunately, our mask compliance is about 40%. It kind of bobbles back and forth, but we're not as compliant as we should be. And we know for a fact that reduces the spread of the virus. We feel good about that data. It continues to come out and support that. The research continues to support that. And so we know that reduces the risk of the spread of the virus. The other thing that we knew was probably going to happen, and that's kind of what we're seeing as well, is as schools went back into session, as colleges went back into session, we expected to see an uptick. So some of that was kind of anticipated. Ideally, all of the schools and the colleges had plans in place to mitigate or reduce the risk of the spread. But I think with even the best laid plans, unfortunately, sometimes you'll have, people get sick, and with every 1 or 2 people that get sick, you're going to have to quarantine, 5, 6 or more. And so that obviously affects school districts as well as colleges. So this is kind of what we were hoping we wouldn't see, but unfortunately we're starting to see.
And the people have read pieces all over the place, and they're coming to their own conclusions, and you have extreme reactions one way or the other. What do we say to people to make them understand how science works and how we have learned over the last 8 to 9 months what we think are the best practices right now?
I'm going to say this on the side of medicine, on the side of science, and side of research. One of probably the most frustrating pieces of all of this is the amount of politics that's gotten involved. And I think it's very unfortunate that this is, it's unfortunate to have a pandemic at any time. It's really unfortunate to have it during a political season where, sides can be taken absent, a discussion on the science, and really can be used as a political weapon back and forth on either side. And I think that's very unfortunate. It creates noise. It creates confusion. It doesn't allow for a clear, concise message. It doesn't allow for groups to be on the same page and deliver the same information to benefit the population. I think that's probably been the biggest disheartening piece of all of this, is how hard it's been to get out good information. In the middle of a pandemic like this, it's hard for us as scientists just to keep up with the amount of information that's coming out. I was mentioning to you earlier on how, we were frustrated at the beginning. There wasn't a lot of good information coming out because we just didn't have the research. And now it's coming out in large amounts, and we're going through it all, and we're trying to figure out what's the best way to treat patients, what's the best way to protect the population, what's the best way to move forward. But a lot of that information is getting lost. It's getting lost, like I said, in the noise of the political season. I think that's unfortunate. In terms of what people can do just to protect themselves and protect their loved one, yes, wear a mask, continue hand washing, continue using hand sanitizers, keep your distance. The 6 feet, that's not a number we made up. We know that respiratory droplets only travel about 3 to 6 feet. So if you can stay 6 feet or more away and wear your mask, you're probably going to be fine. Our big concerns, obviously, as we move into the cold season and get into the winter months, is that people are now going to be inside. So you can't be outside for a picnic or, at Craighead Forest or areas like that. People are going to be inside whether they have to work or be in school or something of that nature. That's just going to allow for more viral spread. And again, that was one of the concerns that we thought we would see. One of the things we're also seeing, and it's not just here in Arkansas, it's across the country, is really the pandemic fatigue. People are tired of it. I mean, I'm tired of it. My family's tired of it. We're tired of it. I want to be able to go back out and do the things that we did before this. If we do that now, we're going to continue to see a significant increase in cases and deaths, certainly here in this region and in the state. And that's what we're seeing. And I've got some information we can provide for that. The numbers, they don't lie. They tell the truth in terms of our number of cases. We're at the highest point we've ever been in terms of Craighead County. We're at one of the highest points we've ever been as a state. And we continue to see those numbers go up. Our cases yesterday were over 1,000. We had over 17 deaths in the state. Those are unfortunately starting to be numbers that we're seeing more of. And I think everybody just needs to do their due diligence to be able to protect themselves and their loved ones.
Yes, I noticed we had the asterisk distinction of having the most cases in the state in Craighead County this week. What I've wondered about it, people will say as we go into the flu season, well, great-grandpa was going to die of the flu if it wasn't this. How do you rationalize or explain the difference? Is there a difference? This is one more thing that's out there, right? I mean, this is not, you're not necessarily going to die of something just because you're old, right?
So that's certainly that's a philosophical conversation I didn't expect to get into with you, Bill. So, and I'm hesitant to go down that road, but I guess technically, based on what you said, you're right. Everybody's going to die of something. My personal choice is I'd rather die later than sooner, but that's just me. What happens is, and I think what gets confusing is that people live with chronic diseases all the time. And when we say a chronic disease, that includes obesity. That includes, I've got reflux. That includes, I take a little pill for my blood pressure. And so people, even though they may not take a medicine for it, people would still have a chronic disease. And anyone with a chronic disease is at a higher risk of a complication, not just from COVID, but from influenza and from a whole host of other diseases. And what happens is when your body's trying to fight off a foreign invader like COVID or like influenza, then it's basically taking resources away from keeping your normal bodily functions moving. And so it's got to go fight on another front, so to speak. We already know, and it's been proven, you can get COVID and influenza at the same time. That's an unfortunate scenario, but that's already happened here in the U.S. And so we've got proof of that. That obviously would be very hard on your body system to try to fight off multiple fronts. If you think about your body as having an immune system, which is basically an army and fighting multiple fronts, you don't want it to have to be split, so to speak. You don't want to split your army up. And that's really what you're talking about. And so, yeah, grandfather may have high blood pressure and diabetes and heart disease and live just fine for months or years. I mean, I have chronic patients with that live years and years. And then the added stress of influenza or COVID is what puts their body into a state where they can't recover from it. So, I mean, like I said, as a physician, I've worked as a hospitalist, as a family medicine physician. I see patients with chronic diseases all the time. People live with these and have full, happy lives and go on vacation and see their grandkids and travel. And unfortunately, though, you can get an illness like this, and that could be something that kind of sends you over the edge.
Ken, what have we learned how are you advising people to behave differently than you would have advised them in February? Anything at all?
Well, I mean, I'll be honest with you. I don't know that our recommendations have changed since, since we first started really seeing this in our state and in our country. And what I mean by that is because we don't have a medication to fight this, because we don't have a vaccine to protect you from this, the only real way to protect yourself is to wear a mask and to socially distance, to wash your hands and reduce your risk of getting infected. That's the best way to protect yourself. And we also know that for individuals that are getting infected, the most likely place for them to get infected is in the home. And that sounds strange, but what I mean by that is I'm far more likely to get infected because one of my kids brings it home from school or from, being at some event or something like that. So what we mean by that is we're seeing clusters, or you're seeing families get infected because one person brings it home to the family and now the whole family gets sick. And so that's nationally, that's what we're seeing more commonly in terms of where people are getting sick. It's somebody bringing it into the household and spreading it to the rest of the home. But in terms of guidance, I would not veer away from what we said before. The only thing I would add is that now you can get your flu vaccine, and we are recommending that you get your flu vaccine when you can now. So certainly sometime by in the month of October, for sure, get your flu vaccine. That's the added protection, just because we know, again, that if your body has to fight COVID and flu at the same time, it's going to be really hard strain on it.
That's a really good way of explaining it. You know, I think everybody can understand. Oddly, we're really good at understanding the Army metaphor more than the medical metaphor, I think. What do we know about long-lasting conditions, Doc? There's been some talk about enlarged heart, which I guess is myocarditis, and the dangers maybe even of exercising in the immediate wake of suffering COVID. What do we know about that right now?
So we didn't know a lot because, to be honest with you, early in this and even through the summer, we didn't have a lot of people that had that we could produce a lot of data in terms of recovery from it. We are now getting more and more, and it's something called long COVID, or if you Google it or if you research it, you're going to see about the long haulers with COVID. And these are individuals, and it's becoming a more significant percent of the individuals that have this, and they've got residual symptoms after COVID. And what I mean by that, and it may not be much at all, maybe just fatigue. Maybe they have fatigue that kind of crops up every few days. Some individuals, they don't really get back to their baseline health status for, weeks or months. Now, it's not common. Most people get over this and are fine, but it is something kind of unexpected. Like, we don't really see that with influenza. We don't see people that struggle with it, weeks or months, after it for the most part. So something called long COVID is new. When you mentioned the myocarditis, the concern there, and you've seen this certainly in the headlines of college football and on professional sports, there's a concern that these student athletes will get infected. Then after they get infected, the virus itself has affected their heart and caused an inflammation of the heart muscle, which is that's what the term myocarditis means, is inflammation of the heart muscle. This is a really unique virus, and we continue to learn more and more about it. And so it's not just a respiratory virus. In fact, it actually gets into your bloodstream and infects a lot of different organs, one of those being the heart. And so this is something that the virus can get into your heart muscle and actually affect it and cause inflammation and irritation. So that can reduce your ability to even just, walk down the street. Certainly if you're an athlete and you're trying to, run wind sprints or something like that, you would be impaired by that. Most of the sports athletic groups are kind of in tune to this, and they're looking for it, and they're screening athletes, and they're trying to make sure that they're fit and that they're in good shape before they return to any activities. But it is something that we're watching for, and something that seems to be showing up more and more in the literature.
Now, and not to be alarmist, because we know that people do recover from this, the largest percentage do. It doesn't mean that we aren't seeing unnecessary deaths. I think I saw that the deaths in the United States from this coronavirus compared to the 1918, 1919 pandemic, U.S. is having a much larger percentage of the deaths, the global deaths, during this particular event. But when people have the typical symptoms of a cold or a flu, they tend to treat it like a cold or a flu. But as you say, when you use the word novel, that means it's unknown, it's unseen before, it's brand new. And how can we get it into people's heads that just because it feels like something you've had before, it's different?
That's hard. I mean, it's hard for most people because, and you bring up a really good point, and this is one of the issues we're going to run into in the fall and the winter. There's common cold viruses that people get in the fall and the winter. So absent of even just the flu, there's a whole host of different viruses that cause the sniffles, that cause a sore throat, that cause a runny nose, that cause muscle aches and fatigue. There's a ton of those. How do I know it's not bad? And how do I know it's COVID? We really don't know, and that's why you got to get tested. And so that's why we're really encouraging testing anytime you feel like that. You know, we've got patients. I've had patients that just had a sore throat or just had a runny nose. They were COVID positive. And you know, you wouldn't have guessed just by their symptoms alone, but you have to be looking for it, to be honest with you. And why it's so important, because that individual with just the runny nose may not feel that sick, and I'm okay to go to work, and they go to work and they infect the elderly person, you know, who's watching the front desk or something like that. And so that's why it's such a bigger deal now, is because we know that proportionately individuals certainly over the age of 65 are getting hit hardest. And so when we look at the percentage of individuals in terms of total deaths, still here in the state of Arkansas, it's 72+% of the deaths are individuals over the age of 65. And so that's really the group that's most at risk. Obviously, if you have a chronic condition, that puts you at risk as well. But from an age standpoint, those over the age of 65 are at highest risk. And so really just protecting yourself. But I mean, typically, if we weren't in COVID, people go to work with a cold. They do. I mean, you know, even though you're told not to, people do. They go to work with a runny. It's kind of, you know, it's like, well, you know, it's not that bad. I can walk it off. I can, you know, I can make it through this. It's just a little runny nose, just a little cough. Now you can't do that. In the age of COVID, you really can't do that. So people have to be more apt, and employers have to understand that it's going to be okay if the employee wakes up and says, I have a headache and my muscles hurt, I don't have a fever. They need to stay home, because if they come in and infect the rest of your workforce, then, you know, you may be out, you know, you may have to shut down, and nobody wants to see that. So I think for employers and employees, it needs to be a reminder that this is not the typical cold season. If you have cold symptoms, you need to stay home and get tested for COVID. Hopefully it's not COVID. Hopefully it is just a routine winter virus, but you don't know until you get checked.
Doc, let's restate one time why we're here today and talking about this in late September. This has been something that people have been dealing with for 8 months. They're ready to hug. You know, they probably are hugging their grandparents again. They're hugging their sons and daughters, and you're supposed to do that if you can do it safely, because you've got to. But explain one last time why now in Jonesboro and Craighead County.
So Bill, the problem is that we're at a higher number than we've ever been since this has started. And based on the predictive models put out by the UAMS School of Public Health, by the IHME, which is what the White House follows, we're going to see for the state of Arkansas right now, we're sitting at about 1,000 deaths. It's expected that we'll be at over 3,000 deaths by January 1. That's just a few months away. So we are expecting a significant number of cases and deaths in the next few months, higher than we've ever seen before this has ever started. And I know that's hard for people. And I do. I think back about this. I think back about how, you know, we had schools shut down when we only had a few cases, and we were really, you know, worried about it. We were seeing what was going on in the Northeast. But when you look at the graphics, when you look at the number of cases per day for the state of Arkansas, when you look at the number of cases per day for Craighead County, those numbers don't lie. And I hope that the viewers will take those numbers to heart and look at it and see where we are, and think about how they individually can impact that to protect themselves and protect their loved ones. Because we're seeing a lot of laxity and apathy, to be honest with you. And I think that's what's resulting in the higher numbers that we're seeing, not only in Jonesboro, but in Northeast Arkansas.
Has any of your scientific research, and I know, again, we as residents and citizens of Jonesboro and Craighead County and all of Northeast Arkansas really owe you and all the other epidemiologists, experts out there, and the doctors and nurses fighting this on the front line. We owe you the thanks that we owe soldiers who come home. We just do. And I think you have done so much research. You've probably done some research on how to talk to people who want to believe it's a political thing, or that it's not really going to affect them. It's not coming to their house. What have you learned about trying to deliver the message to the conspiracy theorists or the non-believers?
That's hard, because the first thing that you would hope when when I talk to somebody or somebody asks me questions, my initial assumption is they want to hear the truth. Right? And they want to hear, okay, what have you read, Dr. Speights and the research that you've done? And I'm always happy to quote and provide any of the articles or any of the research, that I speak of, or that I speak of from NYIT. We've got researchers and PhDs and infectious disease specialists, within our college that have been extremely helpful. Pharmacologists, when we talk about things like hydroxychloroquine, those are things that we feel really good about our stance on, based on the evidence and based on our understanding of how all that works. We do the best that we can. And we try to understand, okay, where are the questions, and I think that's great. And you got to understand too, from our side, like, we typically will have conversations back and forth about, let's say, a journal article that comes out, and maybe I don't really agree with how this was done or how that was done, but we have an academic discussion, and it's a collegial discussion. It really is. So it may be, well, this study only had 26 people in it. I feel like that's an underpowered study. Well, how many people does it need to have in it for it to be fully powered? We talk about statistical significance in terms of, was this study really relevant? And yeah, it was a study that was produced, but was it a relevant study? Was it a good study? And so we go through and kind of peel back those layers internally within our college and within our physicians and our researchers, and have those discussions. And they're all collegial and they're all academic discussions. It doesn't involve finger pointing. It doesn't involve, one side that hates the other side. And so that's kind of the world that we live in. So it's difficult to have conversations if someone is not willing to even listen to the other side, and it's going to be a negative interaction. So those are hard to have. I'll be honest with you. I think what we have done, or what we've tried to do at the college, is just try to stay the course and just say, look, this is what the evidence shows. This is how we interpret it. This is what, we believe, based on our expertise and based on the expertise that we have within our college. And I'm proud of what we have here, in Jonesboro, in terms of the medical school, and what we've been able to bring here to this region of the country from all over in terms of expertise. So it's difficult. I'm not going to say it's not a difficult conversation, but generally, one-on-one, if you can just kind of understand where the individual's coming from, because it's usually not from a bad place. It's just maybe misinformation, or maybe they read this and didn't necessarily understand, or, and by all means, I mean, I'll be the first to admit, we don't have all the answers. I don't have all the answers. And so that's why we continue to learn. That's why we continue to try to read and look at new evidence and try to understand. And I think that's the key, is to try to continue to try to understand.
And that's what science is. It's understanding as we go through new things. So if you're frustrated that you've heard different things from different stages or different reports through this, please don't say, okay, Cousin Joey said this, so I believe this over the doctors, the experts, the scientists, because trust me, you don't want me to determine this. You don't want me being your brain surgeon either. You want to go with an expert. Is a very valuable thing. And Dr. Speights, we thank you for being the medical director for the city. We thank you for your work at NYIT and your diligence in staying on top of this and not going crazy after 8 or 9 months of this, and knowing that there's going to be more. So thank you for joining us today on Let's Talk Jonesboro.
Thank you, Bill. I appreciate the time.
Good deal. And we will be in touch with Dr. Speights as need be in the future. And I'm sure that their need will be there. So thank you, Doc.